It's only April, but 2019 is already shaping up to be a busy year for health IT. Perhaps one of the biggest surprises so far happened just before HIMSS, the Health Information Management Systems Society, an annual event focusing on real-world efforts to improve a patient's overall experience. Just 24 hours before HIMSS started, the federal government announced some big proposals in regulation. That got some people buzzing, and it ended up overshadowing the event. Well, today we're going to talk about those two big proposals. We're also going to get some takeaways from what took place at HIMSS from the Point of Care Partners team. We have two guests joining us for our conversation today. Tony Schueth is the CEO and managing partner here at Point of Care Partners. He's published an article called 8 Impressions from HIMSS 2019. And we also have Mike Burger. He's a senior healthcare information technology consultant, also with Point of Care Partners. And Mike took the lead on the article, 10 Thoughts About the New Proposed Rules from ONC and CMS. Tony and Mike, thanks so much for being with us today.
Thank you, Sunny.
Let's talk about some of these proposed changes from the federal government first. The ONC, the Office of the National Coordinator for Health Information Technology, dropped a 724-page regulation on interoperability and information blocking. Tony, can you tell us more about that?
Well, in the 21st Century Cures Act, which passed right before the end of the President Obama's administration, ONC was charged with improving interoperability and stopping what they call information blocking. So the NPRM, the Notice of Proposed Rulemaking, was long overdue. And it named standards as well as exceptions to information blocking. At the end of the day, we definitely give them an A for effort because this is something that needed to be addressed. But we publicly made the point that where there's a will, there's a way, Sonny. Meaning that we're Americans in a free market society. If the holder of the information has a business reason for exchanging information, it can be done. The exception, of course, is with us, the patients, who should own this data. And the ONC also facilitates that, which is us, patients, getting our information. So it's a really exciting rule that was passed.
All right, thanks so much, Tony. And then CMS, the Centers for Medicare and Medicaid Services, released a slightly smaller report, a 251-page proposal. Mike, what's the focus of that one?
So CMS's NPRM focuses on a bunch of different areas. There are really three that stand out to me as being most prominent. The first is mandating application programming interfaces, or APIs. And it requires those not only from EHR vendors, but also from payers. And so that's new because payers typically don't offer access to their accumulated healthcare data. Really, they just use that internally. So that's a whole new thing for them. And then there's a very large focus on information blocking. And so CMS perceives that one of the challenges to interoperability is that EHR vendors and sometimes provider organizations and health systems are preventing the clinical data from being shared. So they laid out a very detailed proposal about what's allowed and what's not allowed.
Well, guys, everyone seems to have their own opinions when it comes to both of these proposals, but let's break down some thoughts from our team here. Tony, one big question is about information blocking and how it will be enforced. What do you think?
Well, that's a really good question. In most cases, these kinds of things come down to who turns somebody in. See, HHS, they don't have a police force, if you will. They're a regulatory agency and, a branch of the federal government. And so when somebody turns them in, they will begin to look into the problem, and they a lot of times will make identify somebody to hold up as an example. But, in this case, even though I gave them an A for effort, there's a lot of gray area. And so it really remains to be seen how this is all going to play out. What I hope doesn't happen is one of those negotiating tactics where someone says, well, if you don't give me that information, then we're going to turn you in. Something like that would be really unfortunate.
In order for these proposals to work, Mike, payers must make data available through FHIR APIs. Do you think that's feasible?
Well, it's certainly feasible. I mean, payers have to be technology companies to a certain extent, I think one of the challenges, though, is that they're primarily insurers, and in the business of understanding what's on claims and making payments for those claims, and not necessarily on interoperability to make the cache of data that they have available open so others can see it. So I think it's going to be a stretch for them, and I think it's going to be fairly costly for them, but I think it is possible.
Mike, what about the scope of electronic health information? Do you think that's increasing?
Well, that's kind of hidden away in some of this proposed rulemaking, and it's interesting. In the past, the definition of the data that is necessary to be made available for interoperability is focused primarily on the clinical data, so the information that gets gathered in the course of treating a patient in the exam room. With this proposed rule, information which is sometimes housed in a different system, in a patient accounting system, like insurance information and demographic information, also becomes part of what's required to be shareable. So for the technology vendors that are in this space, they need to start thinking about, do they have access to that information? And if they do, how do they expose it to these FHIR standards? So there's some work to be done to make that happen.
Mike, these proposals could also change the rules for certification. How?
Well, so the rules go into sunsetting some of the certification requirements that have been for previous versions of the technology, and it replaces some of the criteria with new and updated criteria. So it makes good sense to sunset things that have already been taken care of and are now in the mainstream, and to keep up to date on the data sets that are necessary. The challenge, though, that it creates, that even if you're taking something away or replacing something with another thing, that requires that the vendor community needs to go in and update all of their code and then recertify. So even though the changes in total are positive, it creates a body of work for the vendors to do.
Tony, admissions, discharge, and transfer notifications, those are already being sent electronically, but now we're talking about coding those. What's your take on that?
In many cases, we're really doing it already, and it just codifies it. You see, CMS is proposing that the Medicare participating psychiatric and clinical access hospitals be required to send electronic notifications to providers and other facilities whenever a patient is admitted, discharged, or transferred. So Medicare is requiring this for their facilities. And the requirement will be important to EHRs serving hospitals, and also those, serving different Medicare. So it's something that we really need to keep our eye on. It's something that's being done, and it's now going to be done in a more widespread basis. And we think that's a good thing.
All right. Thanks, guys. Tony and Mike, I really appreciate your insight today. There is more information about HIMSS 2019 on our blog, as well as those two proposed changes. You can check us out at pocp.com. Also, please reach out to us directly if you'd like more detailed information on how these changes can impact your business.